Hey everyone, my name is Dr Tiarna Ernst. I'm a fertility specialist at City Fertility and a retired elite AFLW athlete. And I'm joined by a familiar face to you all, Cate Campbell.
Thanks for having me, Dr Ernst. And thank you all for following along with this educational model. We hope that it empowers you as female athletes and gives you a better understanding of your body and your menstrual cycle and how you can use that knowledge to improve your performance. Now, one important conversation we need to have is around our fertility options, and that is where you come in, Dr. Ernst. One of the challenges that we face as elite athletes is that we are always focused on that next goal. And some of the consequences can be that we don't think of the long-term ramifications our bodies go through in pursuit of that goal. What does a fertility specialist do? And what options are there for athletes who are still competing or maybe those who are transitioning out of their sport?
Good question, Kate. Well, the first thing is a fertility specialist is a doctor that has trained for many years and is interested and has experience and skills in everything to do with fertility. That might be how to best conceive, and maybe that might be conceiving naturally, or it might even be considering fertility preservation, which is now a real option and a great option for athletes to consider. In terms of those athletes that are might wanting to learn a little bit more about their fertility, there are a number of things that a fertility specialist can offer. There are a myriad of investigations that can be performed to try and determine if there's any concerns when it comes to actually having a baby. Is there something that might need to be done to try and increase the chances of that happening? But also providing fertility preservation options. Fertility preservation is where we try and preserve fertility so that you don't have to think about worrying about having a family when you're focused on your athletic career.
Yeah, it's very difficult to look past that sporting goal into future life goals when you're in that full-on sports mode. What type of fertility preservation options are available?
Yeah, so I guess the main thing from a female athlete perspective, there is oocyte freeze. Oocyte is the medical word for eggs and is often known as social egg freezing, particularly seen in social media, and is quite topical at the moment with a lot of high-profiled media personalities having had this treatment performed or wishing that they had this treatment performed. And from an athlete perspective, we know that you are at your peak of athletic career in your 20s and 30s, but also that is your peak fertility window in terms of conceiving a baby. And so we have an option of preserving fertility by collecting those eggs and putting them in a freezing environment so that you then potentially could utilise those for fertility treatment in the future or increase your chances of having a pregnancy once you have finished your athletic career.
Yeah, it's really interesting. I became an elite athlete at 16 and I've just turned 30, and so all of these topics are really relevant to me now. I'm looking at the end of my sporting career, but then what life will look like. And I think that this is the first time that I've really started thinking seriously about fertility and where that fits in my life. So it's great to hear that there are options for athletes while they're still competing. And then obviously you can work with someone once you finish competing as well.
Absolutely, and that's the benefit of potentially touching base with a fertility specialist early in your athletic career, because they can talk about the options that are available to each individual athlete and their circumstances.
Yeah, for sure.